2021. Sego David Lahashu Juts, and welcome to today's edition of the COVID-19 Task Force Update on this, our 199th edition of Kahnawà 911. We have a relatively shorter show for you today. This afternoon, our only guest will be Lisa Westaway, the Executive Director of the KMHC. Lisa?
Thank you. Good afternoon. So a very short and quick update today. First about vaccinations. So vaccinations of second doses are taking place as we speak today and tomorrow. Just a bit of a clarification, although we have communicated this, it never hurts to say things more than once. So, or more than twice or three times. But we just want to let people know that we are actually not randomly selecting people for second doses. We're actually having to maintain very strict guidelines, which is 28 days from first dose. Therefore, we have a very small window of people that we can choose for second doses, because we also have to use the vaccines before the end of this week, meaning tomorrow. So it is only people who were vaccinated very, very early on in our mass vaccination campaign who will be getting second doses at this time. Again, I just want to remind the community that the 112 days that is at this time recommended by the Quebec government is not the time frame or the time delay that was recommended in the trials for Moderna and COVID, but it has been accepted by Public Health and the Programme d'Immunisation du Québec. And what they do state is that through studies that have been done, that there is not a decrease in efficacy from the first dose to the second dose at the 112-day limit. So although the task force is working hard at this time to decrease the time frame between first and second doses for community members, as of today, the time frame is 16 weeks, 112 days, and therefore we will be giving you more information about second doses as we get closer to the month of June, unless anything changes between now and then. And for those who were vaccinated early on in our mass vaccination campaign, well, you have been chosen, as you know, to be scheduled today and tomorrow. I also want to give information about next week. So although the original, I guess, entente or decision for First Nations communities throughout Quebec was to vaccinate 18 plus. We were able to secure Pfizer vaccines for 16 and 17-year-olds. So we will be releasing information in a memo or a communique later today to let you know that 16 and 17-year-olds will be vaccinated starting next Wednesday. So that's Wednesday, Thursday, Friday from 3 to 6 o'clock. And Saturday from 9 to 5. And you can book your appointments starting tomorrow on Click Santé. And you will be asked to book an appointment at this time because we are trying to control our vaccine supply to see, to make sure that we have enough availability should we need to order more. Therefore, please book your appointments for 16, 17-year-olds, 3 to 6, Wednesday to Friday, and 9 to 5 on Saturday. Again, this information will be coming out on all of our various media outlets. Also next week, as you know and as we've said repeatedly, we will not be refusing anybody from the community, so any residents from the community who change their mind about vaccination next week and would like to walk into the vaccination site. So should that be the case, you will not be turned away, and the vaccination site will be open from Wednesday to Saturday next week from 10 to 6. And therefore, differently from previous weeks, we will be closed on Tuesday, we will be closed on Monday, so don't show up on those days. There won't be anybody to greet you, but from Wednesday to Saturday, if you do change your mind and want your first dose, you can walk into the vaccination site. We wanted to provide a little bit of information today about masks. And I'm sure that you've been hearing a lot about it in the media, and most of it is related to what we're seeing is a really huge increase in transmissibility of COVID-related variants. So we mentioned yesterday that a significant amount of cases new COVID-19 cases are related to variants, and we're at over 60% of new cases within Quebec are related to a variant. And we still don't have very clear scientific information about the transmissibility of the variants at this point, and more so we don't have clear data about the vaccination's effectiveness against the variants, although we do know that vaccines do offer an extra level of protection. We don't know at what level for the variants in comparison to the regular strain of COVID. And therefore, what we're seeing is an increased transmissibility of variants, especially in enclosed environments at sometimes greater distances than 2 meters, and even with cloth masks. And that's why there are new directives that are coming out for the general public regarding masking. So what we would like to recommend for the general public is that as often as possible, at all times when you're within 2 meters of another individual, that you wear 3-ply masks. They could be medical-like masks that you would find at the pharmacy or at Costco, for example. That they be the 3-ply. They could look like medical masks, but they don't need to be medical grade masks. And again, we keep those masks available for health and social service workers, frontline workers, or for education employees, for example. However, it would be beneficial for the general public to be wearing 3-ply masks. And the reason why we bring this information to you is because it has an impact when we do contact tracing. So if you have been a contact of a positive case and both you and the contact were wearing a 3-ply mask and not a cloth mask, that will have an impact on the level of risk that you would have to contract the virus from your contact. And therefore, we are requesting that everybody wear 3-ply masks. And again, we'll be putting that out in writing so that you have that information to reread as you need it. So regarding masks and vaccination, distance, these are all very important points that we talk about on a regular basis. When we evaluate our level of risk in a situation, it's important that we look at all of these aspects, all of these safety measures that we have in place, because all of them put together, distance, so maintaining a 2-meter distance from anybody who doesn't live in our household, hygiene, hand washing, throwing away our Kleenexes, all the things that we've been taught, washing high-touch areas on a regular basis. So distance, hygiene, masking at all times, vaccination. When you put all those 4 elements together, you are at your utmost protection, and therefore you are decreasing your risk of catching COVID-19 or of transmitting it unknowingly. And again, we need to be as careful as possible considering the variants and considering our lack of knowledge at this time about the variants. Well-being is still very important, and so that's the last point that I wanted to discuss. And it really stems from the K103 this morning and some of the discussion around how we're all, waiting to live our lives, waiting to get back to normal. And I just wanted to remind everybody and remind myself as well today, as I did this morning and listening to the radio, that this is our normal right now. This is our life, and that we have I guess that it's really important that we find our pleasure in our day-to-day, every day, because every day is important, and we need to live every day for what it is. And we can't be waiting for the future and waiting for change and waiting to go back to the way things were to live our life and attempt to be happy. So whatever happiness means for you, and that's different for everybody. It could be the smallest thing and seeing the crocus come up, or it could be some big thing and waving to someone from a window or a FaceTime, or whatever the case may be. Figure that out for each of you, for yourselves and for your families, for your loved ones, because every day is important and every day matters. And we all have the responsibility to live our fullest life as we can without waiting for something that might happen or might not happen in the future, because that leads to constant disappointment. And we know we're all disappointed that we can't just go back to normal following our mass vaccination campaign, but we can find happiness in our day-to-day. And summer is here, the sun comes up every day, and we have lots of amazing things that we can do on a day-to-day basis. So please take the time to figure that out for yourselves. That's it. Thanks.
Thank you very much, Lisa. And that's our show for this afternoon. From all of us here, we'd like to say thank you and stay safe. Yawagoa, Danu, Onagiwahi.